Good morning, wherever you are. This is Benji Cross from ConferenceHype. Our segment will focus on comparative risk of cardiovascular hospitalization with immune checkpoint inhibitors versus chemotherapy. From the 2026 July 22 edition of JCO Oncology Practice. Background: while immune checkpoint inhibitors are associated with rare, acute myocarditis, their comparative impact on chronic vascular events and heart failure versus conventional chemotherapy remains ill-defined. Methods: we performed a global, propensity-matched cohort study using a federated electronic health record network. Results: the final cohort included 30,720 matched patients. Discussion: in this large real-world cohort, ICIs were associated with a substantial excess burden of severe cardiovascular events compared with traditional chemotherapy. From the 2026 May edition of JCO Oncology Practice. Background: patients with GI cancers often face significant financial toxicity and health-related social risks, yet best practices for screening remain unclear. Methods: from June 2022 to August 2023, patients were screened using the comprehensive score for financial toxicity, patient-reported HRSR, and quality of life. Results: among 8,335 patients with GI cancer, 45% had a cost score of 26, indicating FT. Discussion: high levels of FT and HRSR were observed in patients with GI cancer. From the 2026 May edition of JCO Oncology Practice. Background: in the era of prolonged survival for advanced renal cell carcinoma with standard of care first-line therapy, now including immune checkpoint inhibitor, re-evaluation of the Memorial Sloan Kettering Cancer Center and International Metastatic RCC Database Consortium prognostic models is overdue. Methods: data from 1,052 patients with ARCC treated on the CheckMate 214 Phase 3 randomized trial with first-line nivolumab plus ipilimumab or sunitinib were analyzed after minimum 5 years of follow-up. Results: with time-dependent assessment, the IMDC and MSKCC models maintained their performance over approximately 2 years from sunitinib initiation. Thereafter, the models' performances with long-term OS attenuated. Discussion: this retrospective analysis of the CheckMate 214 trial, in which nivolumab plus ipilimumab improved survival versus sunitinib with 48% and 37% of patients, respectively, surviving beyond 5 years, confirmed the strength of the model's prognostication for the early years after first-line sunitinib initiation, continuing to stratify 3 prognostic categories, but also diminished discrimination among long-term survivors and with initiation of nivolumab plus ipilimumab. From the 2026 May edition of JCO Oncology Practice. Background: in ASCENT, sacituzumab govitecan showed significantly longer overall survival and progression-free survival than chemotherapy of physician's choice, with similar rates of treatment-emergent adverse events in previously treated patients with metastatic triple-negative breast cancer. Methods: quality-adjusted time without symptoms of disease progression or toxicity of treatment methodology was used to compare treatments where survival was partitioned into 3 health states using the intention to treat ASCENT population, toxicity, T-Wisent, and relapse. Results: SG had significantly longer QT-Wisent than chemotherapy in patients with MTNBC, a difference of 3.5 months. Discussion: the QT-Wisent analysis supports a positive benefit-risk ratio for SG versus chemotherapy in patients with previously treated MTNBC.
This is Conference Hype. Stay with us, coverage continues.
from the 2026 May edition of JCO Oncology Practice. Breast cancer remains a critical global health challenge, with a high incidence rate and significant mortality. In 2022, it was the second most diagnosed cancer worldwide and ranked as the fourth leading cause of cancer-related deaths. The Middle East and North Africa region faces considerable challenges in managing this burden. Among all World Health Organization regions, MENA is projected to experience the highest increase in cancer cases over the coming decades, primarily because of population growth, aging, and lifestyle changes. Extensive analyses of the Global Burden of Disease Study 2019 have revealed a near doubling of breast cancer incidence and prevalence across MENA countries between 1990 and 2019, accompanied by a threefold increase in related mortality. The region also faces unique challenges, including late-stage diagnosis, limited access to advanced diagnostic and therapeutic options, disparities in healthcare infrastructure, and financial constraints affecting treatment accessibility. From the 2026 July 24 edition of JCO Oncology Practice. Background: primary treatment modification is common among older adults with advanced cancer because of aging-related vulnerabilities. Methods: this secondary analysis of the GAP 70+ study was restricted to patients aged 70+ years with incurable solid tumors who initiated systemic therapy with a PTM. Results: the mean age was 77 years, and GI cancers were most common. Discussion: older adults with advanced cancer who received GAR-guided PTM had a 23% lower risk of grade 3 to 5 toxicities and a 53% lower risk of secondary dose reduction compared with PTM based on usual oncologic care. From the 2026 July 22 edition of JCO Oncology Practice. Background: adherence to operative standards and thorough documentation of surgical technique are critical, particularly in multidisciplinary clinical trials. Methods: we reviewed the primary operative and pathology reports of all enrolled patients who underwent complete pancreatic resection. Results: 51 of 126 study participants underwent complete pancreatectomy. Discussion: even in this rigorously controlled, multi-center, randomized pancreatic cancer clinical trial, performance of key elements of technical surgery was inconsistent and documentation was incomplete. From the 2026 May edition of JCO Oncology Practice. Background: survivors of adolescent and young adult onset cancers require comprehensive cancer surveillance care. Methods: patients diagnosed with cancer between 2006 and 2020, age 15-39 years, were included. Results: of 7,925 survivors, 46% were Hispanic, 6% non-Hispanic Black, 11% non-Hispanic Asian, 35% non-Hispanic White, and 65% female. Discussion: although the majority of this cohort received either primary or oncology specialty care, our study identifies those who may need tailored outreach for follow-up care.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May edition of JCO Oncology Practice. Background: cancer is the leading cause of death in U.S. prisons, where incarcerated patients have substantially worse survival than non-incarcerated patients. Methods: semi-structured interviews were conducted with 32 prison medical directors, primary care clinicians, and oncologists caring for patients with cancer incarcerated in 16 U.S. state and federal prison systems between September 2023 and April 2024. Results: interview participants included 9 prison medical directors, 6 PCPs, 1 gynecologist, 15 oncologists, and 1 palliative care clinician. Discussion: the unique and complicated logistics of cancer care for patients incarcerated in U.S. prisons differ from care provided to non-incarcerated patients and may negatively affect their cancer outcomes. From the 2026 May edition of JCO Oncology Practice. Background: collaboration among trial sponsors can pool expertise and resources, potentially accelerating drug development and regulatory success. Methods: we queried clinical trials, for all industry-sponsored, interventional phase 3 trials in genitourinary malignancies completed between January 1, 2010 and October 1, 2024. Results: 78 trials met inclusion criteria from an initial 183. Discussion: sponsor collaboration significantly improves FDA approval rates and timelines in phase 3 genitourinary cancer trials, including those meeting primary endpoints. From the 2026 May edition of JCO Oncology Practice. Iron deficiency is highly prevalent in patients with cancer and has major impacts on morbidity and quality of life. The etiologies of cancer-related iron deficiency are multifactorial, and unlike in the non-cancer population, most patients with cancer-related iron deficiency have functional iron deficiency due to cancer-related inflammation. Diagnosis of iron deficiency in patients with cancer requires different thresholds compared with patients without cancer. Treatment of iron deficiency requires adequate dosing of iron repletion and specific understanding of patient context, i.e., perioperative anemia, concomitant use of erythropoiesis-stimulating agents, use of anthracycline chemotherapy. Intravenous iron is generally preferred over oral iron for iron repletion due to a favorable safety profile and improved bioavailability, particularly in patients with cancer-related inflammation. From the 2026 July 22 edition of JCO Oncology Practice. Background: an increasing number of oral targeted anti-cancer medications are approved with uncertain evidence of clinical benefits, marketed at increasing prices, and subject to insurance coverage mandates. Methods: using claims data between 2016 and 2021 from a large national insurer, we assessed volumes of use and spending on OTAMs approved by the Food and Drug Administration between 2010 and 2021. Results: use of OTAMs increased from 50.7 patient days supplied per 1,000 enrolled patients in 2016 to 120.4 patient days supplied in 2020. Discussion: between 2016 and 2021, the largest shares of OTAM dispensings and spending were for indications with documented evidence of OS benefits.
This is ConferenceHype. Stay with us, coverage continues.
That's it for now for ConferenceHype's coverage of the July 2026 issue of JCO Oncology Practice. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments. Share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.